On the COVID pandemic, and so far 3 waves of it has exposed our health infrastructure completely. Governments after governments neglected the healthcare sector and continue to spend meager amount on it. However, this cannot continue now. Now, only the COVID-hit healthcare sector needs a financial booster shot, but the policies also need attention in this year's budget. Mirror Now's Ayushman Kumar gets you the expectations of the pharma and health sector.
Ahead of union budget, the topmost demand by the healthcare sector is more funds. Last year, rupees 71,268 crore was allocated to the health ministry. However, allocation to Pradhan Mantri Jan Arogya Yojana, which covers Ayushman Bharat and health and wellness centers, was just rupees 6,400 crore. Lack of funds is proving to be a roadblock in extending the ambit of Ayushman Bharat scheme.
That health budget should be primarily spent in creating wellness and also for promoting various health schemes of the government, like most important scheme which Prime Minister launched about 2 years back, that was PMJ health scheme. Many private hospitals do not adopt PMJ scheme mainly because it is not viable. So probably it can be, prices for private hospitals can be slightly different. So they're also involved.
Next on healthcare sector's wish list is tax cut. The Association of Medical Devices in India hopes that the government in the upcoming budget would cut down the GST on medical equipment.
GST needs to be a flat 12%. Medical devices are not luxury goods like cars. So why have 18% GST on certain medical devices? Instead of the imports coming down, last year the imports from China went up by a steep 75%. 75% in 1 year's time. From 5,200 crore rupees, they went up to 9,100 crore rupees.
Post-COVID, there has been a demand-driven growth in the sale of products related to health and safety. The experts say that government in this budget should try and find ways to help the startups working in this area.
Health and safety seems to be the most important concerns for every individual and organization. This is an area the budget could really focus and help India get a leadership position in this area. Funding for proof of concepts, funding the startups, and also tax rebates in this area. So I think health and safety could be a very, very important segment that can emerge as a new segment under healthcare.
The National Health Policy of India in 2017 suggested that India should spend at least 2.5% of its GDP on health sector by the year 2025. Last year, it was just at 1.8%. The health and pharma industry now expect government to pump in more money to strengthen India's COVID fight back.